60% of counties in the United States don't have a psychiatrist. So if you live in the majority of the United States, you can't actually physically get to a psychiatrist easily.
Psychiatrists face a ton of problems. They're continuously forced to see patients for less time than is arguably appropriate. There's a lack of investment in the space, a lot of administrative responsibility, and there's not a lot of people to help them do that.
That's where Talkiatry has really made a difference.
In 2016, I had a home invasion in my apartment. A good friend of mine, she suggested I go and see someone. And I thought, I've got great health insurance, I live in a big city, this should be very easy. But it clearly was not. And so I emailed 20 psychiatrists. Only one responded. And they didn't take insurance, so I had to pay $400 out of pocket. People have created really successful group practice models in other areas of medicine. Why has nobody done this in psychiatry? I met my co-founder, Dr. Georgia Gaveras, who's a triple-boarded psychiatrist, and we saw our first patient in April of 2020. It was obviously a very interesting time, but in that few short years, we've grown to be one of the largest employers of psychiatrists in America.
The mission at Talkiatry is pretty simple. It's to provide high-quality psychiatric care to anyone that needs it and be able to do that on an affordable basis. Talkiatry is incredibly easy for patients. Whichever way you come to us, whether you go to your insurance company's website and you find us through there, or you're referred by your primary care physician, or you just go to talkiatry.com and find us through that way, you're taken through a fairly short but comprehensive questionnaire where you're asked questions specifically to match you with a provider that's going to be the right fit for you.
Our clinicians at Talkiatry get to spend time with your patients with less administrative burden. We offer unparalleled clinical leadership. We have a robust clinician engagement program, and we offer continuing medical education.
Clinicians who work for Talkiatry really enjoy a work-life balance. There's no commute, and this gives them a tremendous amount of flexibility in their personal and professional schedules. Clinicians are really engaged in our supportive therapy model, and this allows them and affords them significantly more time to spend with patients. The common thread of all these clinicians is a desire to provide quality care in a collaborative environment.
We are one of the largest employers of psychiatrists in America, where they're, for a reason, our providers have 80% less burnout than the average psychiatrist. And that's because we provide solutions for all these additional things, so at the end of the day, when they're done seeing patients, they can log off. There's not 3 hours of additional paperwork and administrative time needed.
We want our psychiatrists to feel like they're part of a community and not stress about the things that they don't need to stress about. So we create an administrative support network for them, so all they have to do is be good doctors. We also want to make sure that they feel like they're part of a community, because again, when you have hundreds of psychiatrists all over the country, everyone working from home, it can feel really isolating. So we do create an academic network. We create a network where you have opportunities to engage in research. We create a network where you have an opportunity to engage with the other parts of the company that maybe you wouldn't have an opportunity elsewhere. For example, we have a large technology team. They're involved in any major technological changes that we make, anything that we use in our practice, because these are things that not only reflect on our physicians, but also the things that they use day to day. So we want to make sure that they have an input there.
We can get our patients in under 5 days, which again, in the community, you're waiting 5, 6 weeks, sometimes months to get to that first appointment, especially for children. We are able to see a wide range of population from age 5 and up. Not only that, but we're able to take insurance. These are things that make us unique. In a remote environment, we provide convenience. So if you are at work and you have a private location, you can attend your appointment, so you don't have to take a half day off. If you're in the mountains of South Dakota, we can see you, because if you have a strong internet connection, we're able to get to you. So we provide access, convenience, and we take your insurance. With the average experience level of our psychiatrists being 10 plus years, we're also able to match you to someone who may be tailored to exactly what's going on with you.
50% of psychiatrists don't accept insurance. 50% of psychiatrists don't use a certified EHR. They're literally writing on paper. How does any of that help anyone get better, treat patients better, make the system more efficient? The answer is none of them. We have a massive shortage of psychiatrists in the US. When you look at child and adolescent psychiatry, 70% of counties in America don't have a single child psychiatrist. So if you don't do telemedicine, they are not able to get the highest quality care that they deserve. Talkiatry focuses on education, focuses on longer time with patients, does research to show the outcomes make a meaningful difference when compared with other telemedicine practices or in-person practices. Untreated mental illness or inappropriately treated mental illness, all it does is increase costs for the physical side of medicine. And so Talkiatry has shown that we are able to lower the total cost of care by up to $700 per member per month. by getting patients appropriate behavioral health care in Talkiatry's model that has a massive decrease in ER visits, a massive decrease in inpatient hospitalization rates. This frees up those providers to focus on patients who actually need care and ultimately saves everybody money at the end of the day.
What I tell psychiatrists that are interested in joining Talkiatry is to think about why you became a psychiatrist and think about what you want to accomplish. If you want to provide excellent quality care, want to do it through the telemedicine platform, I can't think of a better place for you to practice.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.